Hello, and welcome to your 2024-2025 Employee Benefits Open Enrollment. My name is Sam Winslow, and I'm the VP of Client Operations here at Cypress Benefits Group, your benefits insurance broker. This presentation is going to be brought to you by Rich Logistics, CAT Global, ISI, and Southwest Freight Lines. This year, your open enrollment will begin on Monday, September 23rd, and run through Friday, October 11th. On Monday, you will receive an email from the Employee Navigator system prompting you to go into their portal and sign up for the benefits for the coming year. This is a mandatory open enrollment requiring all employees to go in and make elections. So what's changing this year? That's always the big question of open enrollment, and this year we are happy to report nothing. There are no major changes to your benefits or the premiums. We were incredibly happy to bring a renewal this year that does not offer any new networks, it does not require you to change cards, and it does not ultimately increase any of your premiums. So what was taken out of your paycheck last year, should you make the same elections, will be the same for the coming year. The only thing that's changing is your deductibles will reset, but everything else is remaining the same. We're incredibly happy to be able to bring that to you this year. As an index for this presentation, we are going to be covering everything from qualifying events to the benefits themselves and then the enrollment process as a whole. So right off the bat, this is the time to make elections, whether that be adding a dependent, removing a dependent, changing your address, making a benefit change. However, outside of this open enrollment window, you would need a qualifying event to make an election. So what is a qualifying event? It's really any major life event that shakes things up. So whether that be marriage, divorce, domestic partnership, status change, birth or adoption of a child, a major move to a different state, anything that you can think of that is a really major life event will allow you to make a change, add, remove dependents, anything like that. But that is the only way that you can make a change to your benefits mid-year outside of open enrollment. On to maybe the biggest feature of the plan, and of course that's going to be the medical and prescription drug. Now, as we mentioned, there is going to be no change this year, so you will continue to have an option to pick between the gold 1,000 deductible PPO, the silver 1,500 deductible EPO, and the HSA higher deductible EPO as well. We'll start off with the gold 1,000, as this is the richest plan offered by Rich Logistics. This plan itself is going to have an incredibly low deductible of $1,000 for an individual and $2,000 for family, with an out-of-pocket maximum being the most that you would ever spend in a year at $4,000 for an individual and $8,000 for family. What's presented here is just going to be a snapshot of the benefits. This is not an entire benefit summary, but it does include most of the major highlights of the plan. So under the deductible and out-of-pocket maximum, we have your major physician services, which is going to be your primary care visit and your specialist. That's probably the most utilized features of a plan themselves. And here you can see it's going to be deductible and then 10%. The deductible, so that just means every time you go to your primary care doctor, you're paying into that $1,000 as an individual. So if a primary care visit runs you $50 to $100, you're paying that into your deductible. So you're getting that deductible lower. And then once that deductible has been satisfied, you're just paying 10%. So again, if a primary care visit is $100, you would just pay $10 after that. The preventative visits are always going to be $0. This is unique and consistent throughout each of the three plans offered for medical, but preventative visits are always going to be zero cost to you. So that's things like your annual physical, mammograms, anything that you can think of that's preventative is going to be covered. They do encourage you to go to those visits to just make sure that you're staying healthy and you catch things early should anything come up. Under that, we have urgent care, emergency room, and hospitalization, inpatient and outpatient. All of these services, again, are going to be deductible and then 10%. That 10% is incredibly low. For most of these features, that's very cheap for, say, an emergency room visit as an example. Under those, you'll see that there's an RX deductible. So that's for your prescription drugs. And in this case, it's $150 per individual. So if you have a family of 5, each one of those 5 individuals has a $150 deductible specifically for them, specifically for the prescription drug. What's nice about this is if you have, again, a family of 5, you have one member of that family that has maybe a very expensive prescription drug, which are all too common nowadays. In that instance, that individual can meet their individual $150 deductible for the prescription drug very quickly, and then they're just paying the flat copays provided underneath. Whereas if you had one that's integrated with medical, as an example, then you'd be paying both for the medical family as well as with the prescription drug. So just with that said, it's really an advantage to have that split individual RX deductible. And at $150, you can meet that pretty quickly. Under that, we have your generic copay at $10, your preferred copay at $40, non-preferred at $80, and then your really name brand specialty expensive drugs are covered at 50% up to $300 maximum that you would pay. On to the next plan, we have your middle of the road Silver 1500 plan. Now, when I say this is middle of the road, it's the middle of the plans offered by your company. However, in the grand scheme of things, this is still an incredibly rich plan. The Silver plan is going to be at $1,500 for an individual. And just to put that in context, the average individual deductible nowadays is right around $3,000. So this is half that. The family is $3,000, but again, the family is always going to be double individual. The out-of-pocket maximum here is $5,010. Physician services, down the board, it's going to be very similar to that gold plan, except instead of 10% after the deductible, it's going to be 20%. Still incredibly reasonable for any of the services on here. It's very rare that you would ever get anywhere near hitting that out-of-pocket maximum. That is just in place to make sure that you're really covered. Down towards the bottom, you will see the RX deductible at $250 per individual. So just a little bit higher than that gold plan, but again, nice that it is split between the RX and the medical deductible, meaning with that, you can meet that RX deductible quicker. Under that, we have the generic, preferred, non-preferred, and preferred specialty, again at 10, 40, 80, and 50% up to 300, so that does not change between the gold and the silver. And finally, over here, we do have the higher deductible plan. This is an HSA plan. So that just means this plan is compatible with a health savings account. And this is for those lower utilizers. So individuals who are maybe just going to get their annual checkup, or they're relatively healthy and don't see a need for health insurance. They want to keep their monthly costs low. This is going to be by far the cheapest per month. I believe it's $11 monthly, roughly, per individual. So about as low as it gets for health insurance premiums. And this way you just know that you're covered. You'll see the out-of-pocket maximum for an individual family is just over the deductible itself. So again, this is a plan for low utilizers. But the fact that it does partner with that health savings account is a great asset to the plan. And it really just means that you can put pre-tax dollars into an account for a rainy day should you have medical expenses. And that way you're not having additional funds taken out of your paycheck for the premium. Instead, you have this money in an account. It's yours. You take it with you if you leave. It's your money, and it can even grow in that HSA account as well. But this plan, just regarding the benefits, again, preventative always going to be $0 in network. The physician services, urgent care, emergency, and hospital, all going to be deductible, and then 20% just like that silver plan. Finally, coming down for the prescription drug, that is a big difference here. This one is integrated with medical. So that just means whether you're going to pick up your generic drug or you're going to your primary care doctor, in both cases, you're paying into that deductible. So it's a team effort here. You're paying on both sides. After that deductible has been met, it's a 20% coinsurance for all the prescription drug copays down there. All right, so that was the major features of medical. Again, no changes there. And then we move on to the member portal. So your carrier is going to be CareFirst Administrators. That is under the Blue Cross Blue Shield network. That is a national network, meaning any provider that accepts a Blue Cross Blue Shield plan will accept this plan. As far as utilizing the card, if you ever get any pushback, they say, we don't accept CareFirst. You tell them, do you accept Blue Cross Blue Shield? If they say yes, they accept your plan. The way that this works is they need to bill the local Blue Cross Blue Shield, but once that goes through, it's all going to be covered under this insurance. So with this, onto the member portal, You can go on to cfablue.com at any time. It allows you to do things like view your member ID cards, view your claims and benefits information. You can pull an EOB, which is an explanation of benefits, find providers, request a mailed ID card, estimate treatment costs. So there's a lot you can do through the portal. We have access to this at the HR and broker level as well. So if you do have any trouble with the site or want to request something through us, we can help there as well. All right, past the medical, we're now moving on to dental, which is offered through MetLife. The core plan is going to be the primary plan that is offered to you at no cost. So this is a free plan to you as an individual, which the company is very proud to be able to offer. This is a pretty robust plan in itself. And then on top of this, if you would like to buy up, you have an enhanced plan that we'll touch on the next slide. This plan is a PPO offering both in and out of network benefits. And across the board here, you will see preventative is always going to be covered at 100%, meaning no cost to you. Under that, we have your basic fillings, extractions, things like that. That's going to be a 30% coinsurance after deductible. And then finally, the major, that's oral surgery, root canals, crowns, things like that. That is going to be 60% to you after the deductible has been met. Deductible for an individual is $50 and family $150. And this plan does not cover orthodontia. The enhanced will. Finally, we have the annual maximum here. This is going to be the opposite than the medical. The medical out-of-pocket maximum is the most that you would ever spend in a year, whereas with dental, the out-of-pocket maximum, the annual maximum here, is the most that the carrier will pay in a year. So MetLife will not pay more than $1,500 per person per year with this plan. For the enhanced plan, this is going to be a buy-up option. So if you want a little bit richer coverage than the core, this is going to be the option for you. It's again going to be with MetLife, a PPO plan offering both in and out of network. But as you can see down below, it does offer slightly richer benefits. So again, the preventative going to be 100% sponsored by MetLife, so no cost. The basic is now a 20% coinsurance instead of 30%. And the major services is a 50% instead of a 60% coinsurance for you. Deductible is also reduced, cut in half there, so 25 for an individual, 75 for family. Orthodontia is offered under this plan, so you'd be responsible for 50% of the orthodontia, and that is for individuals under the age of 19. Finally, we have your annual maximum, which is $2,000 per person per year, and that is, again, an increase from that core plan. All right, and then on to the vision. Vision is going to be a voluntary offering, as only those who need it, but those who do need it definitely need it. Vision is an important benefit here. You can see that this plan is going to have a $10 copay for eye exams, $130 allowance for frames, $25 copay for lenses, and a $25 copay for contacts in lieu of lenses. Over on the benefit frequency, this is something to take into account. This is a 12-24 month plan, and that just means that some of the benefits you can get once a year and others you can get every 2 years. So the eye exam and the contacts you can get once every 12 months, whereas the frames and the lenses you can get once every 24 months. This is not going to operate on a strict schedule like the medical and the dental, where it resets every November 1st. In the case of vision, it's going to reset at time of usage. So if you get an eye exam, you then have 12 months from the date of that eye exam before you can get another one and have it be insured. With the contacts, if you get contacts a week after that eye exam, you then have 12 months from that date of getting the contacts in order to get new ones. So do keep in mind the structure is a little bit different. On to FSAs, so the flexible spending account, which is offered through CareFlex. There are a number of tax incentives here for an FSA or an HSA. So if you're with that high deductible medical plan, you can get the HSA, and for everybody else, you can go with the FSA. These programs allow you to deposit pre-tax dollars, which can then be used on eligible medical, dental, and vision expenses. So what is an FSA? An FSA is also known as a Section 125 cafeteria plan, and it is pre-tax benefits for eligible employees. So an FSA you put funds into at the beginning of the year, and then those funds can be used throughout the year for eligible expenses. This is going to be within the IRS limits, of course, but it does reduce your taxable income, which is a huge takeaway here. You're contributing pre-tax dollars as mentioned, and then you have an actual card that can be used at time of service. So if you're at the pharmacy or you're picking up new glasses, something like that, you can literally just swipe this card. It's incredibly easy. So tax advantages. With this, it's designed to save you money. So with an FSA or an HSA, it's never going to be taxed. There's no federal, state, or social security tax. So every dollar you contribute is pre-tax, reducing your total taxable income and increasing your take-home pay. We have a little example here. So if your annual salary is $35,000 a year, your out-of-pocket medical expenses, let's just say, is around $1,000, and your dependent care expenses $2,500. Down below, on the left-hand column, we can see without an FSA, you have your salary after taxes, Fed, state, and FICA at about 25%. You're paying $8,750 in taxes. Your out-of-pocket expenses, as we covered above, are going to be $3,500 in total. You get no reimbursement from your FSA, and your take-home pay after taxes is $22,750. With an FSA, your gross pay is the same, $35,000. The FSA contribution that you're putting into it is $3,500, and then your taxable income is reduced to $31,500. After 25% taxes from Fed, state, and FICA, that reduces your taxes to $7,875. Your out-of-pocket expenses are then $3,500, and that is going to be reimbursed via the FSA. In the end, your take-home pay is $23,625, meaning you just saved $875 that year. This is just an example of how you can really save dollars by lowering that taxable income here with an FSA or an HSA. Healthcare FSAs. Again, pre-tax dollars for medical, dental, ortho, and vision. Annual contribution limit is $3,200 a year, and $640 of that can be carried over from year to year. One of the advantages of an HSA over an FSA is that the full volume will carry over year to year. If you leave the company, you take it with you. Whereas an FSA, you can only carry over $640 from year to year. So do keep in mind how much you're depositing into an FSA account. The runout period is 90 days. So you have 90 days into the next plan year to submit expenses from the prior year. So just submitting receipts, say you forgot your card one day. And then the maximum dependent age for an FSA is 26. There are quite a few eligible expenses here. Just wanted to include a quick snapshot. It's everything from acupuncture to eye exams, flu shots, LASIK eye surgery. You got nicotine patches, smoking cessation, you have vaccinations, x-ray fees, prescription drug and medications, pregnancy tests. Really, anything that you can think of that is within the realm is probably going to be covered. But definitely make sure you're checking the list before you're submitting for an expense. All right, and now on to Fresh Bennies. This is one of my favorite product offerings by the company. And Fresh Bennies is a way to cut your healthcare costs in one easy app. It is primarily for telemedicine. However, there are some additional features with the product that is offered completely free to you and your dependents as long as you are enrolled in medical. So if you're enrolled in any of the medical plans through the company, this is completely free to you. So there are going to be 4 different major features of the plan. You're going to have your telehealth, your behavioral telehealth, your RX savings, and your benefit wallet. And we'll dive into each one of these specifically on the next few slides. So as far as getting into the system, there's 3 easy ways to do it. I personally use the app. It's a great feature. It works really well on your phone. It's nice and quick. You can also log in online at freshbennies.com, or you can call with the card that you have and just speak with somebody directly. So starting off, telehealth is probably, as I mentioned, going to be the biggest feature here. Up to 70% of medical issues nowadays can be solved over phone or video, and you can reach out 24/7 to a registered physician at $0 cost to you. So if you aren't feeling well, and typically you would go into the doctor, they'd give you an antibiotic, something like that, In this case, you can skip all that. You don't have to take time out of work. You don't have to go sit in a doctor's office. You don't have to have them tell you something you probably already know. This case, you're saving all that time, and then you're saving the money too, because you're not paying for that office visit. It's completely free. And through this, you have 24/7 access to a licensed physician that can write you prescriptions, answer your questions, and provide care. So me personally, unless I have a broken leg or something, I am using this app. I have gotten plenty of things like antibiotics written for when I have cold or flu. So the telehealth component of this is amazing. It'll save you money and it'll save you time. Onto the behavioral telehealth. Nowadays, everybody should be speaking with a therapist, but we do know that the cost associated with that can be pretty expensive. So with the behavioral telehealth component of Fresh Bennies, you can speak with a licensed therapist at any time, again, available 24/7 at $0 cost per visit to you. So you and your dependents can call. You can have somebody specifically that you like to speak with. You can request them, and you can text with them. You can video chat with them. You can email them, really however you'd like to. This is a great feature that, again, everybody should be using nowadays, and it's all just part of the Fresh Bennies package. On to prescription drugs, the savings that can be offered here through Fresh Bennies is very similar to GoodRx, if you are familiar with that. You don't pay the retail price. You can get pretty significant savings. So you would just type in the drug that you're looking for. It shows you a list of pharmacies, what the drugs are, and you can save up to 85% on generic and brand name drugs. The Benefit Wallet is a place that you can store all your different cards. So let's say you have MetLife for dental, you have Care First or Blue Cross Blue Shield for medical. Then you want your Fresh Bennies card in here and your HSA CareFlex card. You can have all those in one app. So you just pull up the app, you have everything in one place. And that way, if you forget your wallet at home or whatever it may be, you have all this information. You can even do personal cards like your gym membership or your driver's license. So this is also a great asset. So that was the Fresh Bennies. Again, a huge feature of the plan. Now we're going to move on to some additional optional lines that you have. This is going to be for accident. With this accident plan through MetLife, again, this is completely optional to you, but it does offer direct cash back for specific injuries. You can see here coma, concussion, different degree burns, dislocation. Pretty much anytime that you have an accident and have a serious injury, you're going to get money back for it. So this is the accident benefit. It is continued here. So there's quite a lot on here. Definitely urge everybody to take a look at these, and certainly if you're accident prone, this might be a good benefit for you. But look at these and see there's also hospital benefits associated with the accident. But the accident coverage nowadays, with as expensive as insurance can be, sometimes it's good to have this additional little cash bonus when you need it. The hospital indemnity plan, that's going to function very similar to the accident. However, in this case, it is going to be direct payments for visits to the hospital. So as you can see, admission, you get $1,000 back. Confinement, $100. And it's going to depend on the days and times that you're in there, but just getting cash back for hospital visits is important nowadays. Moving on, critical illness, again, offered through MetLife. This is going to be for, really serious situations for yourself or dependents, but this is going to be, cancer or long-term treatments like that. And you can get some pretty significant dollars back, as you can see here, $15,000 to $30,000 for you as an individual, 50% for any dependent or spouse. Just kind of continued. You can see a benign brain tumor, you get 100% of that benefit. If it's cancer, 100%. Non-invasive at 25%, skin cancer 5%, no less than $250. So again, a lot of it's with things like cancer, but you can also see they have cerebral palsy, everything down to rabies, you get a benefit. So there's a lot on here that you can receive a benefit for. Heck, even COVID-19 is on here at 25% of the benefit amount. So a lot of ways that you can receive funds for the more serious issues. If we keep moving, the short-term disability, this is a major feature. I do just want to spend some additional time on this slide because short-term disability we consider here at Cypress to be the third most important benefit, right behind medical and life insurance. So the short-term disability is 100% free to you. This is sponsored by the company, and this is going to cover your wages should you be out. The reason it's so important is 1 in 3 Americans will go out on short-term disability in their lifetime. So having this assurance for your paycheck is incredibly important. We all think about how important insurance is, but if you're laid up in the hospital, you're not going to be able to go to work, and you're still going to have plenty of bills to pay, whether that be your mortgage, childcare expenses, whatever it may be. Having this assurance that you are still getting at least a significant portion of your benefits is or of your paycheck is incredibly important. So in this case, it's 60% of your weekly earnings. There's a 7-day elimination period, which is just waiting 7 days to make sure you're eligible for this. There's a guaranteed issue of up to $1,000 per week and a 12-week maximum. After short-term disability, continuing with One America, that kicks on to voluntary long-term disability. So this is an option to you if you'd like to elect it, but this picks up exactly where short-term disability drops off. This is maybe less utilized than the short-term disability. However, for those that need it, they definitely need it. This is going to continue with 60%, so no change on that. It has a 90-day elimination period, but that's simply what the short-term disability would cover. So it just kicks in right after that. And then the package options, you have 3 different options here. You can go for a 2-year package after short-term disability, a 5-year, or until Social Security federal retirement age, so 65 typically. Moving on, we have the term life insurance. Risk Logistics is incredibly happy to offer $50,000 to you as the individual in life insurance at no cost to you. We don't like to think about this, certainly, but it is a part of everyday life. And so it is something that you want to consider and make sure that you are covered for. So the fact that this is covered at no cost to you is a great benefit and a great way to wrap up the presentation here. So that covers the benefits. For more information, please reach out to Human Resources if it's on eligibility, Employee Navigator, anything like that. Numbers provided there. And then for additional information, if you'd like to reach out to Cypress Benefits, our information is there too. And that concludes the presentation. Thank you for sitting through it. Feel free, because this is a video, to go back to any pieces. Feel free to go back to that contact sheet and reach out with additional questions. But please make sure that you're going in and completing your open enrollment through Employee Navigator. And thank you all for the time.